Welcome to our presentation about our experiences at LS Skaggs Wellness Center. This was a half-semester long project in which we implemented ideas from self-determination theory to help improve overall motivation for physical activity and learn how a clinic functions. My name is Cole Martin, and my group mates are Garrett Geisler, Tim Lant, and Diego Luna.
So what is Skaggs and what is our purpose there? Skaggs Wellness Center provides a wide array of services, classes, and workshops such as massages, weight management programs, and fitness prescriptions. The aspect of Skaggs that we are focused on for our capstone is the wellness gym, where we provide supervision of the exercises that the patients are carrying out to assure safety, as well as to help them correctly carry out the prescribed exercise program.
Currently, we are all students at the University of Utah pursuing a degree in kinesiology and are wanting to go into the healthcare setting. Kinesiology is defined as the scientific study of human body movement and addresses physiological, anatomical, biomechanical, and pathological components. Different components kinesiology majors can go into are things like physical therapy, occupational therapy, athletic training, coaching, etc. As stated before, we are all students at the U, and with that, one of our last remaining classes requires us to utilize the knowledge we've gained during our time at the U and help promote physical activity in the community. The class is titled Kines 4900. As a group, we were fortunate to work with the Skaggs Wellness Center in order to complete this.
Our target audience for this presentation is those future students of Kinesiology 4900 and those who are interested in being exposed to a wide array of diseases and disabilities, as well as how to adapt exercises to conform to the needs of the patients.
LS Skaggs Wellness sees many patients dealing with a variety of different afflictions. Most of the patients are Parkinson's, MS, and stroke patients, with many of them being over the age of 55. People above the age of 55 are at high risk for falls, which is important to keep note of when moving across the gym and making sure there is minimal clutter in the gym space. Parkinson's disease is a degenerative neurological disorder that primarily affects movement and muscle control. Parkinson's is associated with a deficiency in dopamine, which is used as a neurotransmitter for movement. People with Parkinson's disease display trembling or shaking, known as tremors, stiffness and flexibility issues, slow movement and balance difficulties. Multiple sclerosis is characterized by damage to the myelin sheath surrounding nerve cells. Symptoms in patients include numbness, tingling in the limbs, issues with balance, weakness, blurred or double vision, and cognitive impairment. MS is more common in women than men and is most prevalent in older adults. Strokes occur when blood to the brain is reduced or stopped, leading to damage and cell death. Strokes commonly happen with clots blocking blood flow, called an ischemic stroke, or a rupture in the vasculature, called a hemorrhagic stroke. Depending on where in the brain the stroke occurred will have great effects on the symptoms. Common stroke symptoms include weakness, especially on one side of the body, difficulties with speech, vision, dizziness, and headaches. Common stroke symptoms include weakness, especially on one side of the body, difficulties with speech, difficulties with vision, dizziness, and headaches. All of the mentioned afflictions require that we carefully watch over and assist in activities when at Skaggs to reduce the risk of injury.
New patients, as well as frequent patients, first get checked in by one of us. Patients get assessed by a physical therapist and are given a personalized workout plan that includes a variety of cardio, strength, and aerobic exercises. Wrist assistant, thigh assistant, and gait belts are adapted techniques that help patients overcome barriers.
In these video clips, Garrett and I will show you what a typical day for participants looks like. When the participant first arrives, we ask them a few questions about overall health and if there has been any recent changes in medical history. Then, we will measure blood pressure, oxygen saturation, and resting heart rate. These values are recorded to ensure that exercise is safe, and participants will not be allowed to exercise if any of the readings show contraindications for physical activity, such as high or low blood pressure, poor oxygen saturation, or a high resting heart rate. After checking in, participants can begin exercising. Like Diego mentioned earlier, a physical therapist has made a clear, unique plan for each individual, filled with stretching, cardio, and resistance exercises to complete each day at Skaggs. Each participant and their independence is different. Some may need constant assistance, while others can safely do all their exercises unassisted. After someone completes their exercises, we will measure their blood pressure, oxygen saturation, and heart rate a second time before we send them on their way.
Our purpose is to improve intrinsic motivation through self-determination theory, including the components of competency, autonomy, and relatedness in patients at the Skaggs Wellness Center. Our main goal is to provide a positive and inclusive environment for participants and to increase overall motivation related to physical activity. Another goal is to assist patients with different exercises in order to increase competence levels.
With the self-determination theory, there are many benefits to using it as a framework in the context of participants of exercise. Benefits include that the self-determination theory can elicit better engagement towards physical activity, specifically autonomous motivation. Also, autonomy is positively associated with improvements in physical activity, volume, and duration. Implementation of self-determination theory increases the chance of physical activity adoption, and self-determination theory can increase relatedness, which increases intrinsic motivation. Competence is an aspect of self-determination theory. So what is it? Competence is defined as the experience of mastery and being effective in one's activity. So, understanding how to complete a specific task along with successfully completing the task will increase a person's competence, and that is really helpful in the context of Skaggs. In the 2007 interventional study done by Fortier et al., the self-determination theory was put to use in an experimental setting to see the effect that the theory could have on a person's autonomy support, short-term autonomous motivation, perceived competence, and physical activity adoption. There were 120 participants drawn from primary care practice facilities in Canada with ages ranging between 18 to 69 years old. To be eligible, they had to report less than 150 minutes of exercise per week and did not have any known unstable or uncontrollable diseases. 61 participants were randomly assigned to the experimental group and 59 were assigned to the control group. Those in the experimental group received a brief 2 to 4 minute physical activity counseling session pre-exercise, as well as 6 more intensive physical activity counseling sessions with a physical activity counselor over the next 12 weeks. The physical activity counselor for the experimental group was given training on the self-determination theory prior to these counseling sessions. The control group received only the brief 2 to 4 minute physical activity counseling session by a healthcare provider with no prior self-determination theory-specific training like the physical activity counselors. What this study found was that the group that received both brief and intensive physical activity counseling sessions had higher reported levels of autonomy support and short-term autonomous motivation, which translates to a higher chance of physical activity adoption by the participants. There were similar results found for perceived competence in both the experimental and control groups, and the study stated that a longer trial of around 3 to 6 months with more sessions would show differences in perceived competence due to time it takes for individuals to gain competence. So when at Skaggs, giving positive feedback to the participants on their effort and the correctness of the task they are performing will help to increase competence.
The next aspect of self-determination theory is the idea of autonomy. Autonomy is the right or condition of self-government, meaning having control of oneself and their own decisions. Because self-determination theory focuses on the self, bolstering a sense of autonomy can lead to higher levels of motivation and success in exercise programming. From the intervention study from Russell et al. In 2010, the researchers used physical activity counseling with a focus on autonomy and a series of questionnaires to assess personal autonomy levels at the beginning, middle, and end of the study. They found that levels of autonomous motivation from the middle of the study were significantly associated with the physical activity duration and volume at the end of the study. These findings suggest that by improving autonomy, people are more likely to exercise and results in better outcomes in clinical settings. To implement autonomy at Skaggs, we focused on equipment usage and making sure the patients feel comfortable and able to use all the exercise equipment. A key point that I focused on was giving participants choices for what order they wanted to do their exercises in. For example, I would say, would you like to start with the tricep pull-downs or the leg press machine? Even though we will still do both the exercises, letting them make decisions and choose the order for their exercise program can help to ensure completion of all the exercises.
The study by Fenton et al. Also relates to autonomy. It was a randomized control trial that consisted of a 3-month program and used a self-determination theory exercise intervention framework to try and increase autonomous motivation and also moderate to vigorous physical activity. Patients for this study must have been diagnosed with rheumatoid arthritis and were recruited from the Russell's Hall Hospital in Dudley, United Kingdom, from March 2010 to April 2014. Out of the total 115 participants, 59 were assigned to the experimental group, but only 32 were included in the final analysis. Whereas out of the other 56 assigned to the control group, only 38 were included in the final analysis. As for the intervention, the experimental group received 4 different one-on-one consultations with the counselor, trained in strategies to promote autonomous motivation relating to physical activity. These consultations included a face-to-face visit prior to the exercise program used for baseline, 2 telephone consultations during the program, both at 1 and 2 months, and a face-to-face consultation post-program, or at 3 months. The study also utilized questionnaires to assess motivation, vitality, and physical activity levels. The authors found that counseling sessions done by a behavior change counselor that was primarily focused on autonomy support, combined with an individualized program for rheumatoid arthritis patients, showed significant positive effects on autonomous motivation for physical activity. This in turn also predicted increase or higher moderate to vigorous physical activity levels and higher vitality. Therefore, this showed that by improving autonomous motivation, we are also able to improve other aspects of an individual's life and thoughts about physical activity. Utilizing this article, I decided to integrate different strategies to try and increase autonomous motivation. In order to do this, I decided to give participants choices in determining what exercises they did, as well as tried to provide explanations regarding health benefits. Another thing I tried to incorporate during sessions was a fun and enjoyable aspect. To do this, I always tried to come in with a positive attitude and smile on my face. I also chatted with patients and joined them in doing exercises to make them feel more comfortable and at ease. Occasionally, we would also create obstacle courses that were not part of the prescribed program, which I think helped with overall enjoyment and put smiles on participants' faces.
What is relatedness? Relatedness is one of the 3 psychological needs outlined by self-determination theory. Relatedness is the need to feel accepted by others and a sense of belonging. The research paper titled A Self-Determination Theory and Acceptance and Commitment Therapy-Based Intervention led by Lev Ari aimed to increase adherence to physical activity found that participants who were treated using SDT approach were significantly more likely to participate and adhere to recommended levels of physical activity. The study had 24 males, 89 female participants. They were randomly assigned 3 groups: SDT group ACT group, and traditional intervention group, and a non-intervention group. The authors found the SDT and ACT had a significant positive effect on physical activity, participation, and motivation. The SDT treatment group also experienced increase in relatedness, which appear in increase in intrinsic motivation.
This sense of relatedness really shines through at Skaggs. I've been amazed at how friendly all the participants are. It really feels like its own community, with everyone excited to see each other. Some days it would be quiet, waiting for the next person to show up. Then as soon as they walk in the door, Skaggs would come to life and you could feel everyone's mood go up tenfold. Having such a strong sense of camaraderie motivates not only the participants, but also the employees, leading to a very healthy and inviting environment.
We encourage communication between members and encourage them to share experience about their workouts. We have observed relatedness between the patients at Skaggs as two patients discuss how much they enjoy the new step, and they share their experience with each other.
In order to collect data from Skaggs, we created a survey specifically for Skaggs based on a questionnaire using a scale from 1 to 10. With that, we tried to integrate questions that were more general, but also tried integrating questions relating to the self-determination theory framework in order to get an understanding of where our patients were in terms of autonomy, competence, and relatedness. Results from the survey showed positive changes in many different areas, with only negative changes in 2. The areas that were negative were overall health and motivation due to friends. The highest changes from the survey were seen in comfortability in using equipment alone, along with the sense of community felt at Skaggs. Tying in the self-determination theory, this would be represented as positive changes in terms of competence and relatedness. Reasons this could have occurred are due to clear and concise instructions given by us, familiarity with equipment along with being able to interact with other patients while at Skaggs. From our experience with the patients at Skaggs, we found that words of affirmation, encouragement, and just talking with patients all proved to be viable strategies in terms of the self-determination theory framework. The biggest thing we learned while at Skaggs was that increasing competency through explaining proper and accurate forms for exercises help foster an increase in overall intrinsic motivation towards physical activity. Throughout our times at Skaggs, some things we learned were gaining a better understanding of how a wellness center runs, how to adapt exercises to the needs of patients, along with just experiencing firsthand how diseases affect people. Something that surprised us was just how capable individuals were and how competent they are with the equipment and exercises they used. Something future practitioners should be mindful of are the words and things they say, and to be aware of each participant's whereabouts to ensure a safe clinical environment. This experiment was not done without any limitations. Some of those limitations include time, as this was only a 7-week intervention, sample size, as we had under 50 total individuals, variability in patients, as oftentimes we worked with different individuals week to week, and self-reported data from patients. For more information about the Skaggs Wellness Center, contact Scott Hadley.